I'm here now with Glenn Smith. He's a researcher from the University of Florida, a neuropsychologist studying behavioral intervention and how it relates to people who have mild cognitive impairment. Hi, Glenn.
Hi.
Thanks very much for joining me.
My pleasure.
Okay, let's just first start with how much we know about altering behavior with people who have MCI.
Sure. Well, there's a lot of research from epidemiology that suggests lifestyle factors influence your risk for developing dementia or MCI. So by logical extension, many of us wonder if we intervene with those lifestyle factors even after you've developed MCI, could that delay or slow the progression of, if not cognitive change, at least functional decline in people that have Alzheimer's or MCI due to some other cause.
One of the things that you've done is you've actually conducted studies of helping people with a program to improve their memory, and those people who you have isolated as who have mild cognitive impairment. Tell me a little bit about that program.
Sure.
and what you've learned.
A lot of the interventions we're engaged in don't necessarily help people's memory get better. Rather, it's intended to help people function well in spite of poor memory. So some of it is as simple as developing a habit of writing things in a calendar, checking them off, developing a to-do list, and tracking it to make sure you know you've done it. And importantly, also learning to write down things that are important to you that maybe you would have previously had no trouble remembering, but now that slips away, and when you need to call that up later, it's not there.
Is there a way to use neuroimaging to actually see if people's memories are improving?
Right. So when we do neuroimaging study, there's several different things we can look at. We can look at how good is the blood flow to the brain. We think a lot of exercise trials that have shown some benefit on people's cognitive function, the primary mechanism must be through making cerebral blood flow better. There's the structure of the brain. The brain is shrinking in Alzheimer's disease in certain key areas, and so sometimes we study, can we slow that rate of atrophy through various physical or cognitive exercises. But then there's also the circuits of the brain. How are they organized? And there's certain patterns of efficient brain processing we can see on what's called functional neuroimaging. And so we study, do these interventions actually maintain the integrity of those circuits or not?
Okay, and then one of the most important questions that I'm sure you come across all the time is, well, what can we really do right now? I mean, and you're focused, obviously you're not focused on people right now who have dementia, it's more mild cognitive impairment, but what are some of the lifestyle or the most important things that you tell people to do?
I think that there is very solid literature on three things that people should do as often as they can bring themselves to do them. Physical exercise. We like yoga in our program because it's very adaptable, but if you like to walk, if you like to swim, lift weights, exercise, and do that as, within moderation as much as you can. Cognitive engagement. You can go out and purchase computerized games and play those, but one of the things about cognitive exercise that we're coming to understand is it has to be novel. If you've always done crossword puzzles, doing one more crossword puzzle may not have the same positive impact as doing something totally novel like learning a new language or trying to master a new skill. Then the third thing is social engagement. There's a fair amount of evidence that being around other people and being engaged socially helps it, through mechanisms for all of these things that we don't fully understand, and yet the data from epidemiology is pretty compelling.
I want to talk a little bit about brain games because, there's a lot of controversy around that. What really works, what doesn't work, and you hit on a key point. It's really changing the pattern of thought. But what about those games that all of us have gone to those websites and seen, improve your memory, do these games? Right. How do you know which ones work and which ones don't? I mean, a lot of those I could go on and I've never played them before. So is that good for my brain?
Yeah. Well, first, going back to mincing words, None of them have been shown to improve your memory. Because when you and I think about memory, we think about, I just learned something and I want to retain it later. Most of these programs have been shown to improve your processing of information. So it might help you more rapidly see things in your environment, or more clearly process things that are coming through your ears. And neuropsychologists like me describe this as improving processing to enhance working memory, or your ability to hold things in your mind and process it a little bit. So if you're engaging in those games because you want to, be better at remembering your friends' names in a social setting, I'm not sure they'll deliver for you. But they do show positive impact on working memory. And working memory is something that is foundational to all other kinds of thought processes we engage in. One thing to do is to go to their websites and see if they can have studies listed there from independent organizations like the University of Florida or University of California, Los Angeles, or University of Hong Kong or whatever, and see if there is some evidence behind them.
Is there a type of game, like when you were reviewing these, was there a type of game that was particularly more impactful than another? Is there a way to generalize that?
Well, there's been two areas of research that have the best data so far. When you engage in these games, you're using one of two sensory modalities, vision or hearing. And there's lines of research for each. The vision training, actually what it's been shown to be most helpful with as we age, is our ability to look at the environment and notice details in it. That ability actually shrinks as we age, so our focus, not necessarily our vision, but our attentional focus narrows. And so this research on this aspect of processing we call useful field of view has been shown pretty routinely to enhance our ability to notice more of the environment and process it better. On the auditory side, what's been shown to be most helpful is if as I'm talking to you at a certain rate, and there's so much of my information you can process, and some of it you just have to let go of. That also shrinks as we age, so that when we're young, we can hold 8 or 9 or 10 things in our mind and process it. By the time we get to be 65 or 70, that might shrink to 4 or 5 kinds of ideas or objects. And so the processing training, just like it's expanding the visual field, is expanding your capacity to hold and operate on information. And so activities that do those two things by giving you more and more information that you have to process more and more rapidly, that's where the science is the best.
So the behavioral research that you're conducting on people who have MCI, what could that possibly do in the future for dementia or Alzheimer's patients?
Right. Two people may have the same amount of plaques and tangles in their brain from Alzheimer's disease. One of them may have a whole lot of symptoms associated with that, and one of them very little. So we talk about this concept of reserve, which is the brain or the person's ability to absorb brain insults and still function. And what we're trying to do through our behavioral efforts is enhance that reserve. So even if we can't remove the plaques and tangles in your brain, we can give you the capacity to continue to function better than you would have otherwise for longer.
Great. Thanks very much, Ken.
Yeah, my pleasure.
All right.